Good morning and welcome to New South Wales Health's COVID-19 update for Tuesday the 8th of June 2021. New South Wales recorded no new locally acquired cases of COVID-19 in the 24 hours wait clock last night. 5 overseas acquired cases were recorded in the same period. 2 previously reported cases have been excluded after further investigation, bringing the total number of cases in New South Wales since the beginning of the pandemic to 5,414. 11,219 tests were reported to 8 o'clock last night, compared to the previous day's total of 13,773. New South Wales Health administered 14,687 vaccines in the 24 hours to 8 o'clock last night, including 5,408 at the vaccination centre at Sydney Olympic Park. The total number of vaccines administered in New South Wales is now 1,515,485, with 514,412 doses administered by New South Wales Health to 8 o'clock last night. 1,001,073 were administered by the GP network and other providers to 11:59 p.m. on Sunday the 6th of June 2021. New South Wales Health is treating 25 COVID-19 cases, none of whom is in intensive care. New South Wales Health was notified on Sunday evening that fragments of the virus that causes COVID-19 have been detected in the Castle Hill sewerage network. This catchment includes 8,400 people and takes sewage from the following suburbs: Glenhaven, Dural, Kenthurst, Kellyville and Castle Hill. People who have recently recovered from COVID-19 can continue to shed virus fragments into the sewerage system for several weeks even after they are no longer infectious. Anyone in these areas is asked to be especially vigilant in monitoring for symptoms. If they appear, please get tested immediately and isolate until a negative result is received. New South Wales Health continues to ask anyone who lives in Gundagai, Goulburn, Jervis Bay, Huskisson, Hyams Beach or Vincentia, or has visited these areas since the 19th of May, to watch for symptoms after 4 travellers who later tested positive for COVID-19 spent time there. Please keep checking the New South Wales Health website regularly, as the health advice for venues in these areas may be updated. Ongoing investigations into the movements of the cases have identified 232 people as close contacts. None have tested positive to date. Anyone who has been in Melbourne recently is reminded to keep checking the list of venues of concern on the Victorian Department of Health and Human Services website. Further venues have been added and this list may continue to be updated. New South Wales Health urges anyone in the state to continue to take practical measures to stay COVID safe, including practicing good hand hygiene and always using QR codes to check in and out of venues. We recommend wearing a mask in any situation where physical distancing is not possible, such as on public transport. If you have even the mildest of symptoms that could signal COVID-19, please come forward for testing immediately, then isolate until you get a negative result. There are more than 300 COVID-19 testing locations across New South Wales. To find your nearest clinic, visit our website or contact your GP. Thanks very much.